I'm a professional sexuality educator. My name is Dr. Ruthie, and I blog over at exploringintimacy.com. But thanks to the great folks at funwares.com, I'm here helping you by answering your questions on sex and relationships. So let's get started. All right, here is a wonderful email that came in recently. Dear Dr. Ruthie, I have been having a very long dry spell. It's been a long time since I've had sex. I am a woman, and I generally have sex with men. And what I want to know is if I can just jump back into having sex again, or if my body might have problems. Thanks. Fantastic question. So let us deal with the most complicated scenarios and then move our way to the least complicated scenarios. And you just pick and choose which of this seems like ways that you might want to prepare. Now, I don't know what quite a long dry spell means for you, whether that means days or weeks or months or years or a couple of decades, depending on the person. Any of those could be considered a long dry spell. And I also don't know how old you are, so there are some considerations there about the health of your body. So the first things first, if you are, whether or not you're of reproductive age, you're going to want to think about different forms of protection. I'm trying to avoid stereotypes here, but research tells us there's a little higher risk for folks who are more mature to be less likely to use protection. And that might be because they may not feel that they're at risk for pregnancy, or they may not be at risk for pregnancy. However, protection is still really important. Things like syphilis are booming in the baby boomer generation and older. So protection is definitely called for. Different sexually transmitted infections are really happening with this crowd at high rates. So you're at risk. You may not be at risk for pregnancy, assuming that you didn't want to get pregnant, but you may very well be at risk for other things. So visiting your doctor or your local sex educator or health services agency to help you figure out what is the best form of protection for you. There are some options. If you're looking for barrier methods, we've got male condoms, we've got female condoms, dental dams, and gloves. I've done videos on using all of these things and the importance of them, so check the YouTube channel, Funwear Store, on YouTube, and scroll through those different videos to find them there. And you know, a good clinic can give you information on how to use all those correctly and how to pick the right ones for you, because there are a lot of brands of male condoms out there. As far as I know, there's only one brand of female condom, but it takes a little bit of a learning curve to learn how to use it. So I've done a video on it, but you may want to have somebody, you know, hold it up and show you in person how to finagle it, that sort of stuff, and then practice ahead of time. Gloves and dental dams, or in some cases plastic wrap, can be really useful for manual and oral sex, respectively, as well. So good. So we've got our protection down. It's not just for birth control, it's for protection. If you are of reproductive age, you might want to double up and add in a prescription birth control through your doctor or your healthcare provider as well. It's always really useful to do a 2-for-1 pharmaceutical prescription, 1 barrier method. Don't use 2 barrier methods at once. It isn't twice as safe. It makes more friction. They rub on each other. It can actually increase the risk of both of them breaking. Whoa, backfire. So that's not the kind of doubling up we want to do. Don't double bag. So we've taken care of those sorts of ideas, but I feel like what you're really asking is my body ready? And that's a great question. If it's been a really long time and you like to be penetrated, which may or may not be the case, then it may be that your muscles are a little out of shape down yonder. So what I would suggest is, if you're not using sex toys to practice with penetration, and I'm making the assumption that that's an activity you're interested in, if I'm wrong, just ignore this part, then I would suggest getting yourself a couple of sex toys, from small to about average phallus size or a little bigger, and just practicing with those yourself, warming yourself up, getting really comfortable, learning your body's responses again on when you're ready for the next size and if, and it may be that you need to work yourself up over time. And you know what, this practice should be fun, and it should be happening at least 3 times a week. I really might suggest that, as long as it's fun and comfortable for you, going ahead and doing that daily for at least 15 to 20 minutes. having fun and learning to relax and learning to work with your body to kind of work your way up with these different sizes. You can buy an official dilator set if you want to, or you can get a few very smooth insertable toys, maybe with vibration if you like that are body safe and healthy, and a really good body safe, body healthy type of lube. Again, check out my other videos for more information on how to find those. If it is anal penetration that you like, same deal. Don't switch the toy back and forth between the two places without cleaning it well first, mind you, and make sure you have a flared base, and watch some of the other videos and read up on anal penetration and safety in toys. But you can use that with both areas to get in good shape. And that good lubricant is really important. I would also suggest, and this might sound a little cheesy, but if you don't do yoga or any kind of stretching activities, you might want to do that, because you're likely to find yourself in some positions where your muscles aren't used to moving that way anymore, in your thighs and in your torso and things like that. So getting a little good at doing some stretching exercises each day for those various positions is good for your body in all sorts of ways, including making sure that you don't pull a thigh or something embarrassing like that while you're getting it on. If you find that your body just isn't getting into these positions as comfortably as it once was, that's okay too. Check out some high quality positioning cushions that they make for different sex positions. You can shove a pillow under your butt or under your leg, but it might not work as well as some of these cushions that are designed for it. They're a little bigger, they're a little firmer, they're shaped a little differently, they're made out of washable fabric, stuff like that. So all these things can be really useful to you, and it can be, a good idea to just communicate to your partner and be like, hey, I've been focusing on other stuff for a while, but now I want to focus on sex. So, I learned some things about myself recently because I watched this video on how to get ready. And this is what I'd like to tell you that works for me. Like, I like moving a little bit more slowly, or I really like these positioning cushions, or it really helps me to start out with a vibrator. And just work that into your play as well. That's not a problem. That's communication for better sex, and that's what we all want. And I wouldn't be surprised if your partner has some useful things to communicate to you that's helpful for him or her too. I'm Dr. Ruthie. I hope that these ideas help you get ready for sex and are useful for you in ending your dry spell. Congratulations on your decision to make this change in your life from less sex to more sex. And if you decide you want to have less sex again, then congratulations on that too. I'll see you with the next video.